Khan on aesthetic plastic surgery. So thanks for joining me. We're just going to work on a little bit on the corners of the mouth here. So I have a nice hyaluronic acid here. And I like to just go right into the vermilion border here to first start lifting up the corner. And you can see just it hits that vermilion border and it just starts filling in. And that just frames the lip right there. And then what I also do is just go into the corner here, where the corner of the mouth here, which starts the marionette line. I just go right into that particular area, and you can just see the corner already lifting right up. Just a few drops of filler right there. But you can see how it just nicely just picks up for her. And then boom. So you can see how that corner looks compared to the other side. Nicely picked up, slightly going up, and this side's down. I haven't done that side yet. So just want to show you some of the subtlety and the beauty of doing the corners of the mouth to help upturn them with very, very carefully placed filler. It's so important to place it properly. Otherwise, if you don't, it's going to make it look worse. So very important to pick the right person to do these injections and to have a lot of experience doing this. And it's certainly artwork as well. So I love making my patients look and feel their best, and this is just one way to do that. So here we are just framing the lips. We go right into the vermilion border, and then we get right into there. And I like to just frame the lips by injecting the border of the lip. And when you're in the right plane, it just fills in very nicely. So I'll bring this all the way up to Cupid's bow. And then I'll also accentuate the bow by just putting a little bit of filler here. And then make that tip, the point of the bow, very nice. It just helps pick it up very nice like that. I can get this side by doing the same way. Pinch right there. And that just fills it in very nicely. So she'll have a nice Cupid's bow there. And then filling the lower lip here, I just go in through the corner here. I hit that nice potential space there, along there, and just frame the lips. So when she wears her makeup, her lipstick, it'll just very nicely stop at the edge of her lip, which is exactly where you want it. So certainly a lot of artistry involved with doing the lips. So I just frame the borders here, and then I have a drop left here. So I'll just go into the corner just like I did the other side, and then just pick up that corner of the mouth there. You can just see it picking up very nicely. So that's the artistry of doing the lips. You want to frame them, pick up the corners, and then lastly, I'm going to actually fill the border, fill the body of the lips, so she has more plump lips and she has more of a vertical show, make the lips look absolutely beautiful. Okay, so Dr. Khan here. Now bring your chin up a little bit higher. We're actually going to go into the body of the lip now. I framed the border before, so now I'm going into the body of the lip just to give her more plumping action here. And just very nice. I'm using a non-bruising blunt tip cannula here to help just make them really nice. And I always like to inject a little bit further back in the lip, and that's going to help actually accentuate the volume. And now I'm going into the lower lip here. And again, in the body of the lip, a little bit further back behind the wet-dry junction of the lip mucosa, and that's just going to help give very nice, beautiful contour to the lips. Okay, perfect. So that's the right side. We'll do the left side in a minute. Start. All right, so on the left side now, I just make a little entry point with my little sharp needle, and then this is my blunt tip cannula. It's not sharp at all. It's basically a blunt tip. And this is analogous to having a paintbrush under the surface of the skin. Just open a little bit. And over here, I just want to get right to the body of the lip on the left side. And then we'll just start injecting here. Now I like to roll the lip back. So I love these injection cannulas, as non-bruising blunt tip cannulas, because I'm basically not using a sharp needle and going in and out of the lip and creating a lot of swelling. And so I don't like to treat my patients like pin cushions. I like to just use a minimal amount of injections, needle entry points, so we're not having like track marks along the lips and that type of thing. So, and everybody requires a different type of contour with the lips and has a different aesthetic that they like. I like to customize my lip treatments as well as all my toxins, my neurotoxin and filler treatments, just because patients always want a little bit different of a look. So I customize it depending on what exactly they require or what they want. So, but you can see we're almost done here with the lower lip. And I already framed them before, and just a very nice, beautiful aesthetic. And she'll hardly have any swelling after this. So, all right, beautiful. So you can see her lips; they look beautiful, and all this swelling will settle down within a day or two, and she'll be runway ready. So, thanks for tuning in.